For the best nursing lectures, subscribe to our channel and press the bell icon to stay connected and tuned with us.
Hello everyone, myself Tony back with the NCLEX RM Preparation Part 10. So let's begin. Starting from the 46th question, the client with suspected meningitis is admitted to the unit. The doctor is performing an assignment to determine meningeal irritation and spinal nerve root inflammation. A positive Cunning sign is charted if the nurse notes option A, pain on flexion of the hip and knee, option B, mutual rigidity and flexion of the neck, option C, pain when the head is turned on the left side, या option D, dizziness when changes position. So let's see the correct option, and the correct option is option A, pain on flexion of the hip and knee. So let's see why this is correct. Cunning sign is positive if pain occurs on the flexion of the hip and knee. The Brodisky reflex is positive if pain occurs on the flexion of the head and neck onto the chest. So answer B is incorrect. Answer C and D might be present but are not related to Cunning sign. So your patient is suspected with meningitis and has Cunning sign. So we have to prefer the patient A option, pain on flexion of the hip and knee. Option C and D might be present but are not related to Cunning sign. And option B, flexion of the head and neck onto the chest is the reflex of the Brodisky, not the Cunning sign. So the correct option is option A, pain on the flexion of the hip and knee. Further moving to the 47th question, the client with Alzheimer's disease is being assisted with activities of the daily living when the nurse notes that the client uses her toothbrush to brush her hair. The nurse is aware that the client is exhibiting option A, agnosia, option B, apraxia, option C, anomia, here option D, aphasia. So let's see the correct option, and the correct option is option B, apraxia. So let's see why this is correct. Apraxia is the inability to use object appropriately. Agnosia is loss of sensory comprehension. Anomia is the inability to find words, and aphasia is the inability to speak or understand. So answer A, C and D are incorrect. So the correct option is apraxia. Further moving to 48th question, the client with dementia is expressing confusion late in the afternoon and before bedtime. The nurse is aware that the client is experiencing what is known as option A, chronic fatigue syndrome, option B, normal aging, option C, sundowning, या option D, delusion. So let's see the correct option, and the correct option is option C, sundowning. So let's see why this is correct. Increased confusion at night is known as sundowning syndrome. This increased confusion occurs when the sun begins to set and continues during the night. Answer A is incorrect because the fatigue is not necessarily pleasant. Increased confusion at night is not part of normal aging. Therefore answer B is incorrect. A, delusion is a fixed belief. Therefore answer D is incorrect. So patient has dementia and has confusion in late in afternoon and before bedtime. So patient experiencing sundowning because it's a syndrome which increase the confusion. So the correct option is option C, sundowning. Further moving to 49th question, the client with confusion says to the nurse, I haven't had anything to eat all day long. When are they going to bring breakfast? The nurse saw the client in the day room eating breakfast with other client 30 minutes before this conversation. Which response would be best for the nurse to make? Option A, you know you had breakfast 30 minutes ago. Option B, I am so sorry that they didn't get you breakfast. I will report it to the charge nurse. Option C, I will get you some juice and toast. Would you like something else? Yeah, option D, you will have to wait a while. Lunch will be here in the little while. So the correct option is option C. I will get you some juice and toast. Would you like something else? So let's see why this is correct. The client who is confused might forget that he ate earlier. Don't argue with the client. Simply get him something to eat that will satisfy him until lunch. Answer A and D are incorrect because the nurse is dismissing the client. Answer B is validating the delusion. So here client with confusion has eaten breakfast 30 minutes before conversion with nurse. So we have to not confuse the client more and say them we will get some juice and toast. Would you like something else? So the correct option is option C. Further moving to 50th question, the doctor has prescribed Exelon for the client with Alzheimer's disease. Which side effect is most often associated with this drug? Option A, urinary incontinence. Option B, headache. Option C, confusion. Here option D, nausea. Let's see the correct option, and the correct option is option D, nausea. So let's see why this is correct. Nausea and gastrointestinal upset are very common in clients taking acetylcholine inhibitors such as Exelon. Other side effects include liver toxicity, dizziness, unsteadiness, and clumsiness. The client might already be experiencing urinary incontinence or headache, but they are not necessarily associated. And the client with Alzheimer's disease is already confused. Therefore, answers A, B, and C are incorrect. So here we are preparing the Exelon for the client with Alzheimer's disease, and Exelon has common upset of nausea. So the correct option is option D, nausea. So friends, thank you for watching. If you like this lecture, give a like and subscribe our channel. We will updating videos of NCLEX regularly. We will be back with part 11. Till then, be happy, stay home, stay safe.
Do like, leave a comment, and share with your friends.